When the CDC made an announcement last week, May 15th, 2021, that fully vaccinated people could begin to remove their masks in indoor and outdoor settings, in most places, with a few exceptions that have been listed, that announcement, the state of Rhode Island was in support and agreement with. And yesterday at the press conference, May 20th, 2021, Governor McKee and Dr. Nicole Alexander Scott, the Rhode Island Department of Health Chief Medical, also said they were fully in support. So in Rhode Island, those who are fully vaccinated can remove their masks in outdoor and most indoor settings. There are a few exceptions that have been listed. That announcement, there was many people who had some confusion, including myself, I admit. I was a little surprised. I've been involved in the Rhode Island Department of Health meetings and their weekly information sessions and committee meetings. And I've always heard that the recommendation here across the United States and in Rhode Island that the vaccination number should reach 70%. Here in Rhode Island, we have a several million population. And in order for us to be able to defeat the disease of COVID, we must have at least 70% of the population fully vaccinated. That way, that if someone does have COVID, most people would not be able to contract it, and there would be such a small percentage that could receive it that it would be something that could be defeated. So I do want to share with you Dr. Fauci. He is the head who specializes in diseases at the CDC. This is the sign that I use, and you see him often on TV answering questions about COVID. He said he wanted to clarify, so I would follow suit. The CDC made this announcement last week, and the announcement was geared to those who are fully vaccinated. This was the announcement to people who are fully vaccinated, that it is safe for them to no longer use a mask in most settings. The chances of someone contracting COVID is very low. It's 0.001%. It's a very small percent. For those who are not yet vaccinated, we're not forcing people to be vaccinated, but the CDC and the Rhode Island Department of Health want to emphasize that what we have seen with science, they're comfortable with this earlier than expected time. Around the end of the summer, before the fall, before school opens and colleges reopen, when the summer is done, we thought at that point there would be a no mask requirement, but this is a little earlier than expected. It's important for us to look at the numbers, the science and the research and the statistics. As of May 21st, in the state of Rhode Island, the people who are fully vaccinated, that number is 517,980. It's about 49% of the population, which is over 1 million people. So about half of the people have been vaccinated in Rhode Island. Now, across the US, the whole United States, the CDC says the number of people who are fully vaccinated is 126,605,166, which is over 126 million. And that is about 38% of the US population who have been fully vaccinated. So here in Rhode Island, we're at 49%, and the US is at 38%. So the US is this, both of these are below the 70% mark. And that's why people were a little bit hesitant. Should we continue to wear masks or not? And there's a lot of confusion. So now my advice would be that since in Rhode Island and across the US, we haven't met that 70% benchmark and we're still working towards it until we reach that 70% benchmark by the end of the summer, potentially. If people continue to go and get the vaccination between now and then, I would say, and this I'm speaking in my own personal opinion, this is Mike Baer's opinion. This I'm not representing the CDC or the Rhode Island Department of Deaf and Hard of Hearing. I personally would say that I'm going to continue to wear a mask every day in normal activities, keeping one in my wallet with my driver's license, my medical insurance card, credit cards, wallet or purse, a backpack, however you carry your necessities around. I would include a mask in that. You know, sometimes people have left them in their car, but now it's good to keep it with you. So when you're out and about, I might be taking my mask off in certain places, unless at the park it begins to get overcrowded, or if you're in a downtown area of the city and it begins to get a little crowded. I've been fully vaccinated, but I will wear a mask if I'm going into certain stores just to play it safe. Regardless that the percent of contracting COVID is low, that's what I personally will do. That is my recommendation. Dr. Fauci has said a very similar thing. At the age of 79, he said he and his wife will continue to wear a mask while out and about, just to stay on the safe side. And Dr. Fauci said he's refusing to fly at this point. He would rather drive where he needs to go for vacation, for visiting his daughter, and I'm going to take his advice. So I wanted to let you all know that, and you can take that and mull it over. Hopefully I've explained this clearly. I know that there have been a lot of changes recently, and now we're at the point where we're making this announcement of removing mask restrictions. And until there's no more confusion about where to wear a mask and where not to, I think people need to take that personal responsibility, as I will. For those of you who are not yet fully vaccinated or only partially vaccinated, meaning that you only have one shot, I ask you, please, from the Department of Health and the CDC, ask you to continue to wear a mask, please, and show respect. I understand people have various reasons that they don't want to get vaccinated, and that's understandable, but please show respect to others and continue to wear a mask and be honest with that. I know we want to continue to protect each other as a society. And, you know, if it happens that you did become positive with COVID, and you might be not realize that you are positive and be out and about and spread it to people who aren't yet vaccinated, and that's not fair. So we just ask you to be considerate and continue to wear a mask until you make a decision or until COVID has been defeated and eliminated. When that will be is unknown, but science is continuing to do research, and they're feeling that they're getting close to that place of being able to find that answer, but they're not there 100% yet. So hopefully that will help you. And if you have any questions or need clarity or confusion, want something signed, please call the Commission for the Deaf and Hard of Hearing at my office. I'm happy to answer any questions, or you can invite me to go to a group that you may have I did just go to the Rhode Island School for the Deaf and meet the students this past Wednesday, having a great conversation with all of them. They asked great questions, and being able to have that information in sign language is so valuable. So call me or email me. My video phone number or voice is 401-216-5414. Or you can email me at this email. Okay. Stay safe, protect yourself, protect your household, your family, and protect others. Wearing a mask when necessary. As I told people, if you are feeling unsure, wear a mask. Play it on the safe side and mask up, protecting yourself and protecting